Hi, everybody. This is Michael King, and I'm joined here by our surgeon, Dr. Dan Sambursky, and we're super excited to spend some time with you here today. We are going to be going through the top 10 questions about LASIK, and this is an opportunity for you if you've been considering laser vision correction and you're just have a lot of questions on your mind. We hope that you'll find that this be a great resource for you in your journey to clear vision. And at the end of this, after going through some of these questions, if you'd like to find out if you're a candidate, we'd love to invite you in for a complimentary evaluation at our clinic. And so, Dr. Sambursky, before we get going, is there anything you'd like to say to people watching the video?
I'm just glad you can share your time with me, and we're happy to answer your questions. And hopefully when we get finished, you'll have a good understanding about LASIK. Some of your fears and questions will be answered, and you'll be willing to take the next step and really come have the opportunity to have LASIK.
Excellent. So with no further ado, let's go into the first question. So question number one here, the first question we have is, what is the recovery time and how much time do I need to take off of work? So let's talk about, someone's having the procedure done. What should they expect in the first few hours after the procedure and then the coming days afterwards, and especially how it pertains to their work? What are your thoughts on that, Dr. Sambursky?
Well, as you know, LASIK is a very quick procedure. It really is 10 minutes and then you're done. When people leave the office, their vision's a little blurry, and that's normal. And most people feel a sensation of something's in their eye, a little scratchy sensation. It's usually maybe, short-lived, anywhere from 2 to 4 hours, occasionally 6 hours, where people feel some discomfort. We always treat patients with Valium, and that helps people go home, take a nap. And really the recovery is very quick in terms of going back to work. Most people can go back to work the next day. I always suggest they take the day off just in case, but if they had to, they can go back to work. And we've had lots of patients do that.
Excellent. Next question we have is, and this is a very common question that patients have, is can LASIK treat astigmatism? So perhaps just in our answer, let's talk about what is astigmatism, and I guess the second part is, which is the question, can LASIK treat astigmatism? Thoughts?
Michael, that's a great question. So a lot of people don't know what astigmatism is, and there's actually a stigma about astigmatism. Really, astigmatism is just a curvature of the cornea. So if you imagine a basketball, no matter how you turn the basketball, it's always round. With astigmatism, it's a little bit more football shaped, where one curve is a little steep and the other curve is a little flat. And yes, absolutely, LASIK can fix astigmatism, whether you're nearsighted, whether you're farsighted, or you just have astigmatism. LASIK is a great solution and it treats it quite well.
Excellent. Next question is, what is the difference between LASIK and PRK? So in our answer, let's talk about what's the difference between the procedures, but more importantly, for those people watching the video, why would our solution, why would we might prescribe the solution of having LASIK or PRK? What sort of circumstances would cause us to choose one versus the other for our patient?
When I first started doing laser vision correction, which was over 20 years ago, we started with PRK. PRK is we just treat on the surface of the cornea. The surgery itself uses the same laser technology to get rid of someone's prescription, but typically nowadays we reserve this for people who have very thin corneas. Occasionally there's a brand of the military that requires PRK, or someone has some irregularity in their cornea and will use PRK. PRK heals much slower than LASIK. So I always compare it to the rabbit and the tortoise. At 3 months, you really get to the same place.
Yeah.
But out of the gate, LASIK is much quicker recovery. People back at work much quicker and much less pain. PRK does tend to hurt, and we put a contact lens on people's eyes for comfort. And usually over 2, 3, 4 days, people do quite well with the healing, but it is a slower recovery for sure.
Excellent. Next question is a very common one, and one that, if you think about it, laser vision correction is, for some people can be a little bit scary. And so, the question of, does it hurt? Like just what sort of sensations should somebody be expecting when they're actually having the procedure done?
So that's also a great question. Does LASIK hurt? It really doesn't hurt. We use topical anesthetic drops, so there's really no pain during the procedure at all. There is a moment where things get dark. We actually talk you through the entire procedure. I actually have someone hold your hand during the procedure. But I would say most people are afraid of LASIK once they do it, they're like, oh my God, I should have done this 10 years ago.
Yeah.
There's really very little to be afraid of with LASIK. The technology is amazing, our software is amazing, and the results are amazing.
Excellent. Next question is, how much does LASIK cost? And I'll be able to tackle this one. At our practice, laser vision correction, whether it's LASIK or PRK, is $27.50 per eye. We do have some very affordable, zero money down, 0% interest financing options for 12 to 24 months. What I would say about LASIK pricing is it's one of the most, there's a lot of confusion, I would say, sometimes people have where, maybe if you are looking online, sometimes you see a teaser pricing of, really, really low pricing per eye. Don't be fooled by that type of advertising. Really, top level technology from a very reputable practice should be around the pricing that I just mentioned. And really, the best first step for you is if you want to be able to know exactly which is the right procedure, cost, and be able to help you out with financing options, is to come in for that initial consultation, and we'll be able to go through all of that for you and make sure you feel 100% comfortable and that it does fit within your budget. Next question is LASIK permanent, or do I need to have it done multiple times? It's a very common question. Dr. Sambursky, thoughts?
So interestingly, when we first started doing LASIK, the software and the technology wasn't as good as it is today. So there was a significant incidence of what we call regression, where we treat the patient, especially the higher prescriptions, and then some of their prescription would come back and they would need a touch-up. Nowadays, it's very uncommon that people need any sort of enhancement, although it can happen depending on prescriptions. But the technology is so good that with our nomograms and our laser platform, really most people are treated very well the first time.
Yeah, and just to add to your point, if you think about it, we get a wide variety of patients that come in, everybody from -1 to -10. And, if you, the lasers are incredibly accurate, but if, for any reason, your eye maybe under or over responds a little bit, and if we have the opportunity to get you a better visual outcome, we want to be able to provide that option for you. And so I think it's, it's not necessarily a bad thing if you need to have a second correction. It's just, our dedication to you and getting you the visual result that you want. If we can be able to do that through a secondary procedure, just to fine tune the results, and we want to do that for you. So
to expand on that, you're exactly right. You have the opportunity of having the procedure, and if we need to enhance it to make it that much better for you, we're happy to do that. We want to give you the best results. It's not like you do it one time and all of a sudden you're stuck with it. We can make it as good as you want it to be.
Excellent. Next question is one that if you're considering laser vision correction, the idea that there's a laser coming near your eye, it's natural for you to think about, are there any side effects from laser vision correction? And so, common ones that people have talked about are maybe dryness in their eye or night vision disturbances. Dr. Sambursky, when somebody asks you this question, are there any side effects after LASIK? How do you respond to them?
So usually what I tell everybody is there's always a risk with any procedure. Nowadays, with the technology, the risks have become very, very small. We want our patients to have good outcomes, so we screen everybody to look for any potential that can lead to some sort of risk that we know would make you unhappy. So ultimately, we do our best to screen people out who we think are at risk for complications or any sort of side effect. And we do a good job at it. I tend to be very conservative. So not everyone's a candidate for LASIK, but those people who are candidates tend to do quite well.
And our next question I'm going to answer, is LASIK safe? LASIK actually is one of the safest elective procedures in the world today, and millions of these cases are done per year. And in my mind, when you're thinking about the safety of laser vision correction, well, there's a couple things to keep in mind. Number one, no elective procedure in the world today is 100% without any sort of adverse effects. But what I can tell you with laser vision correction is because we're not actually going deep inside the eye. It's a surface level treatment. What we're doing is we're reshaping the curvature of your cornea. And the way that analogy I like to give to patients is, imagine that your eye is like a lake of water and that there's a little bit of ice that's on that actual lake. LASIK is the process of reshaping that ice. So it's really a very safe procedure. Are there any sort of adverse effects after the procedure? I'll tell you of a couple of them that are temporary. The first of which can be some night vision disturbances as your eyes are healing. Your eyes might be a little bit drier after the actual procedure. But as far as anything catastrophic happening in the history of LASIK, there has never been a recorded case of anybody losing their vision completely or going blind. To me, when it comes to for us determining whether or not you're a candidate, that's really one of the most important parts of safety, is that we only do laser vision correction on patients who are outstanding candidates. And so you could rest assured, after Dr. Sambursky has done tens of thousands of these procedures, you are in fantastic hands for your procedure. We'll be able to go through any and other questions that you have about the safety of LASIK at your actual consultation. So with respect to dryness of your eye, if you already are predisposed to having dry eyes, there's things that we can do to help you out, which is a collagen plug to go in your tear duct. You may have a little bit of dryness in the first, couple weeks afterwards, which is totally normal as your eyes are, just kind of going back through the healing process. And, to expand upon what you mentioned on technology, the technology today with wider optical zones and just a more accurate sort of measurement of your visual challenges and being able to bring that into the treatment, night vision disturbances like glare and halos are pretty much for the vast majority of people, if it's going to happen, it's going to be extremely temporary and not something that long-term that they have to deal with. Dr. Sambursky,
the glare and halos,
yeah,
are common the first few weeks. They tend to get better, and it's hard for me to even think of someone who has significant glare halos that's permanent. When I actually had the procedure, I had it a long time ago, I did have some glare and halos, and over time it went away completely.
Excellent. Next question is, for those of us who are past the age of 40, and this is one where there's a little bit of confusion that people have, is that, hey, I'm past the age of 40, can LASIK correct my reading vision? Or let's talk a little bit about the solutions that we offer at our practice to be able to help those people who are having issues with their up-close reading, and what happens if they have LASIK and how that affects their reading vision.
So typically, if someone who's nearsighted and they're over 40, really over 45, we'll see that when they have laser vision correction, they find that they need reading glasses. And this is just a normal phenomenon. People who never wear glasses, once they get into their mid-40s, will start wearing reading glasses. Mm-hmm. So if you're a little bit nearsighted and you have LASIK surgery, you'll notice that you can't read as well as you could without your glasses. For the bulk of patients who are very nearsighted, it's a very easy trade. For those people who have a low prescription and read a lot without the glasses, we'll explain to them the risks of having LASIK in terms of losing their near vision. Some options are, we can do what's called the camera, which is the inlay that allows people to read. We also do what's called monovision. Mm-hmm. Use one eye for distance and one eye for up close. So there are solutions. And people who are farsighted and over 40, when they have LASIK, all of a sudden they can see better up close. So it's worth at least getting a free examination, finding out what category you're in, and we're happy to explain all the different options and solutions for you.
Excellent. Next question is just, for those people who, you've gone through the process of researching and now you really just want to find out if you're a candidate, let's talk about those next steps. And before we answer, the one thing I would want to say is that, this is your journey and this is your life. And, our hope is that by providing you with transparent answers to your questions, that really, the decision isn't whether or not you want to have LASIK. The decision is, do you want to find out if you're a candidate? And really that just involves taking that first step and coming in for that consultation, which is free. So Dr. Sambursky, for someone who's like, all right, I'm ready to find out if I'm a candidate, what is that experience like when they come in our clinic?
Well, when people come in, you have to expect to be here for about an hour and a half or so. We do a very extensive, thorough examination on the health of your eye, and we answer all your questions. And it's very exciting actually for people. Once people work up the courage to come in and get an examination, they're excited about the prospects of not wearing glasses or contacts. You think about how difficult it is to deal with your glasses and contacts. We've just gotten used to it, those people who wear contacts or glasses. It's just part of your life. But once you have the procedure and you don't have to use them anymore, you realize what a hassle it was to have to deal with it. Every time you travel, you'll have my spare pair. Every time you go to the beach, can I find my family without my glasses? There's a lot of hassles that we've just incorporated in our life and we've gotten used to. Yeah. Once you have the freedom of having LASIK, you'll be amazed. And patients always say, the two things that patients always say is, I would have paid double had I known it was going to be this good. And number two is, why didn't I do this earlier?
Yeah, that's a very, very common one. So if you are in that position and you would like to find out if you're a candidate, we'd love to extend you that invitation to come on into our practice. You can be able to schedule it on our website, or you can be able to just give us a call at our practice. But with that in mind, Dr. Sambursky, I'll give you the final word. Any closing comments you'd like to say to people who are watching this video?
One other thing I'd like to talk about in terms of pricing is that we do honor insurance discounts. So if you have IMED or VSP, we do honor those discounts, and we are happy to see you, and go local. You're in good hands.
Thank you so much, everybody. Have yourself a wonderful day. We look forward to seeing you in our practice.
Thank you, Michael. It's great to be with you.